Hello, I'm John Mendoza, Director and Founder of ConNetica. We've been focused on suicide prevention for a number of years, made numerous submissions to parliamentary inquiries, Senate inquiries, proposals to government to address this problem. Regrettably, over the last 10 years, we've seen suicide rates in Australia climb by 20%. If this was any other public health issue, we would have had a very strident policy and sustained investment to address that issue. We've not seen that, and it's time now that Australia takes assertive national policy in relation to suicide prevention. It's time that we implement the recommendations of the National Mental Health Commission, which were delivered to government in November 2014, fully 18 months ago. The Australian Labor Party has committed to implement those recommendations in specifically the 12 national suicide prevention trials. But we've got no details from Labor as to what that will actually involve. We're yet to hear from the Coalition or the Greens in relation to their responses to what Lifeline Australia has described as a national emergency. The data that ConNetica has delivered and released covers 28 federal electorates across every jurisdiction in Australia, except the ACT. What it shows is enormous variability in suicide across our country. It shows that we need regional responses, regional solutions with a national strategy and a clear commitment for 10 years of ongoing, sustained effort to turn this national emergency around. We know that suicide has already become the leading cause of years of life lost, 3.3 times the number of years of life lost to suicide as compared to breast cancer. We can see that suicide numbers now exceed road fatalities by a factor of 240%, while we have made massive strides in reducing road toll in Australia over the last 40 years, but even in the last 10 years, we've seen a 25% decrease. We have not gone anywhere, and we are going upwards in relation to suicide and self-harm. This requires urgent political action, national leadership, local coordinated action. We're calling upon all the parties to detail their responses to the National Mental Health Commission recommendations and to spell out the details around the 12 national trials. We're also asking that every candidate for the Senate and for the House of Representatives election on the 2nd of July spell out to their community what they will do to tackle suicide in their region, because it requires their commitment as local leaders working hand in hand with services, with local government, with other service providers and community groups, business, all of them coming together to tackle the suicide problem. It will not simply be solved by more money from Canberra. It has to have some money from Canberra, it has to have national leadership from Canberra, but most importantly, it has to have local coalitions of people working together to resolve the problems that are unique to their area when it comes to suicide and self-harm. Thank you.